This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning. Columbus Mayor Andrew Ginther gave an update on the coronavirus efforts being made here in Central Ohio. Let's go to his remarks this morning on Columbus Concerns.
Rapidly changing circumstances surrounding COVID-19 have caused great concern and raised many questions from the general public and our city employees. But let me start with some assurances from the Director General of the World Health Organization. We are not at the mercy of this virus. The great advantage we have is that the decisions we all make as governments, businesses, communities, families, and individuals can influence the trajectory of this epidemic. The decisions that Governor DeWine and Dr. Amy Acton have made to reduce the spread of the infection and protect our residents. What we do today as a city will greatly impact the length and severity of an outbreak in Columbus. Columbus has tools to help us implement the state orders. I've asked our Board of Health to consider issuing a local public health emergency in the coming days. While we do not currently have any confirmed cases of COVID-19 in Columbus, it is necessary that when we do, and it is when, not if, our Health Commissioner, Dr. Mashika Roberts, is empowered with all the tools at her disposal to ensure the health and safety of our residents. This time I'll let Dr. Mashika Roberts explain the specifics of a local public health emergency. Dr. Roberts?
Thank you so much, Mayor Ginther, and thank you all of you for joining us this afternoon. These are really unprecedented times, and we are doing everything in our power to protect the health and safety of all of our residents. Our public health response to COVID-19 has been multi-layered. Columbus Public Health is building on yesterday's orders of the state to use all the resources available to us to limit the spread of this highly infectious disease. To that end, Columbus Public Health will convene an emergency meeting today at 2 p.m. The Board of Health will convene an emergency meeting at 2 p.m. to vote on declaring a local public health emergency. This declaration is important because it will give us additional safety measures now before we need them. As the mayor said, it is not a matter of if, but when. First, as health commissioner, I can quarantine and isolate individuals, including city employees, if necessary. Most people who work with us when we ask them to be quarantined or isolated, but sometimes we run into difficult situations where people are resistant. But if needed, in the event that someone is not cooperative, this order allows us to take additional steps as a city to quarantine and isolate individuals. As a last resort, and I must say, as a last resort, it could also include placing a police officer outside the door to ensure that the person complies with our orders. Second, the local public health emergency mandates testing and treatment to ensure people are getting appropriate care. This could include ordering medical examinations and treatment and quarantine individuals who refuse exams. Also, it will allow us to control and limit ingress and egress to and from public areas, including determining the routes, modes of transportation, and destinations to evacuate people or provide emergency services. This third provision is especially important to prevent a hotspot of disease in a building, a facility, or neighborhoods to prevent spreading it beyond that specific location. There is no better example of that right now than what we're seeing in New Rochelle, New York, a suburb of New York City, where there is a 1-mile coronavirus containment zone following an outbreak of dozens of cases related to a house of worship. Large gatherings in the area are prohibited. Schools, houses of worship, and other buildings will be closed for 2 weeks to promote social distancing and allow for deep cleaning. That's in New Rochelle, New York. That containment zone is designed and necessary to slow the progression of this disease. While we don't need these emergency powers now, it is important to have them in place before we do need them. This is part of our community planning and preparation for this epidemic, which is now a worldwide pandemic. We have said all along that it's not a matter of if, but when we get a case here in Columbus or Worthington, which Columbus Public Health also covers their public health services. We're preparing for the worst, but hoping for the best. But we must be prepared with every resource that is available to us. We are committed to protecting the health and safety of our residents, and we will do whatever it takes. Declaring a local public health emergency now allows us to be ready when we get the first case in our community, and it gives us additional tools and resources to slow the spread of the transmission of this very contagious virus. As Health Commissioner, I am grateful to the support of our state leaders, Mayor Ginther, and all of our healthcare systems and partners. Protecting public health requires all of us working together. We have a great team in place, and we are working 24/7 on COVID-19 to protect our residents, our visitors, and our community. Thank you. Mayor Ginther.
Thank you, Dr. Roberts. I appreciate your ongoing guidance and leadership. The city has another tool that we can implement, which would be for me as mayor to declare a state of emergency. Let me be clear, I am not doing that today. But in the event, we would need to take extra precautions in the coming days. A state of emergency would allow the city to require non-essential city employees to not report to work. The majority of city employees are working on the front lines in our neighborhoods: first responders, public health nurses, code enforcement officers, building inspectors, community health workers, just to name a few. And one of my responsibilities as mayor is to look out for the health and well-being of our city employees who work tirelessly every day in service to our community. I've asked our directors from each city department to take proactive measures to promote the health and safety of the public and employees alike. They are identifying essential and non-essential personnel, and our Department of Technology is working to maximize the city's capacity to allow employees to work from home where applicable, and if that should become necessary. Our Human Resources Department will work with supervisors and employees under the terms of their respective collective bargaining contracts to make certain employees may take leave as necessary. No city employee will be disciplined for absence without leave for reasons related to a COVID-19 event. In addition, insurance copays for COVID-19 related treatment will be waived by the city. International travel for city employees is prohibited. Domestic travel will be limited to mission-critical travel and approved case by case. These travel restrictions do not apply to personal travel. While travel may be limited, the city is working to promote the use of other technologies, such as web conferencing, to allow employees to continue to collaborate, if not in person, virtually. Be assured that the police and fire are reviewing current policies and procedures to ensure that we keep our officers and firefighters safe, and in turn, keep them in a position where they can respond to the community's needs. Many companies are already directing employees to work from home. I applaud and encourage those efforts, and encourage other businesses to evaluate what is possible for their employees. I've also asked our directors to assess their operations and determine what adjustments, if any, need to be made. In an effort to prevent the spread of COVID-19 virus, the Columbus Department of Public Utilities is suspending water shutoffs through April 15th. The ability to wash hands is essential to protecting residents and families from the virus. In addition, the department will also cease power shutoffs through April 15th. These are extraordinary times. Water and power will help Columbus area families cope with the global pandemic. And finally, we will be closing all of our recreation centers and canceling all program to close business today. In order to best advocate for social distancing, this is critical in reducing the spread of COVID-19. The centers will remain closed through April 3rd to coincide with the state's closure of schools. We stand ready to work with Columbus City Schools and other partners to help meet the basic needs of the residents impacted by these decisions. As many of you know, we are one of the largest sponsors in the state for a summer meal program and work with Columbus City Schools and other partners in the community to provide after-school meals during the school year. We're exploring options right now on how we could partner with the schools and other service providers to make sure that we are feeding children during this extended break. It may be different than we've done it before, but we have to ensure the basic needs of our community are being met during this time. While you've heard it repeatedly, it bears stating again. Wash your hands frequently, cover your cough or sneeze, and stay home if you're sick. As uncertain, disruptive, and inconvenient as these times are, the health and safety of city employees and our community is my top priority. Together, we will work through these unprecedented challenges. But I remind everyone, be kind, be patient, be flexible.
And the state of Ohio gave an update. Dr. Amy Acton, head of the health department.
Right now, for certain, we have 9 males and 5 females. We now have an age range of cases, 34 years to 66 years of age, with a median age of 48. And their illnesses, not the case, because as we know, we started testing. Our first case was, I believe it's been a long week, Monday. But their illnesses started as far back as February 25th and as recent as 3/11. We've had 4 hospitalizations, no deaths. The number of counties with cases, and this is, you'll be hearing more as more and more test results come back today. 6, we have Belmont, 2, Butler, 1, I think there's more information coming there. Cuyahoga, 6, Stark, 2, Summit, 1, Trumbull, 1. Again, it's very hard to keep up with these numbers. I'll explain that. Cleveland Clinic did get the ability to test and went live today. So they're actually doing their own testing, which is helping speed this up. And Dr. Wiley shared with me this morning that they can do 500 a day. So that is our first big surge forward in testing. And UC did announce 4 cases, I believe, as well. They have another under investigation, but they're doing a combination of our lab, and they did have, I think LabCorp was involved, a private lab. So all that comes back to ODH, and we'll summarize that and be printing that out. We do have 50 negatives. We have 159 under investigation. So again, we're up operating three testing cycles. Our EPIs are now on, our epidemiologists, our disease detectives are working 2 shifts of 12 hours. I do want you to know, when we talk about testing and even some of the drive-through testing that the hospitals are trying to get underway, you must have a doctor's order. Health departments don't do testing. You really need to talk to a doctor, preferably at this point, call them. and they'll talk through this with you. As we see this disease spread, we will know that most of us will hopefully ride it out at home. That's so important. So you'll need to talk to your doctor. They'll decide and do a thorough history with you and decide about that testing and give you instructions on how to do that. So with that in mind, I must say I didn't mean to go viral yesterday in any way, and that has led me to want to give a little bit of a science lecture. For those of you who know, I was a professor of global public health at Ohio State for many years, and I'm going to go quickly because I know it's tiring to stand up here, but I think this is so important. I'm going to do my very best to kind of break this down in a way that's understandable. I want to walk you behind the veil of what's been happening with all of this. I've told you all along that there are, ever since 9/11, there's huge effort on preparedness that goes on at the federal level, at the state level, in my department, and at the local level, and that involves many players. And so we've had these pandemic plans, often based on flu research, and those are all underway. They're there all the time, and we were certainly working ours from the beginning of hearing the first cases in China. And as you've seen, the heroic efforts that the CDC and the federal government are taking. I've said all along that these things are not perfect. I have to keep reminding my own team and myself that if we can get this 80% right, that still makes a huge difference. And if you remember, on that curve, everything we're doing is trying to decrease, slow this disease transmission down. We know it's here. We're slowing it down. We're trying to decrease that logarithmic spread of one person giving to 2 to 3 people and on, so that people stay safer, that we keep you healthy, but also so that our health system can handle the sickest patients. When you are involved in this work, and my colleagues around the country, you'll understand what I mean. And somebody had this famous quote, on the front end of a pandemic, you look a little bit like an alarmist. You look a little bit like a Chicken Little, the sky is falling. And on the back end of a pandemic, you didn't do enough. And that is your fate in my role, and that will be the fate of all of this, because whenever a pandemic has come and gone, or any infectious disease, but in this country, and what's so important, because timing is everything, in a 2-week period, one city took dramatic actions, St. Louis, and 2 weeks later, Philadelphia started doing the same actions. And the trajectories for the two cities were widely different. So we know that balancing the right action at the right time is so important. This work, bird flu was was more deadly than the regular flu, but it wasn't very infectious. H1N1 came along in about 2009. It was spreading more, but it was actually less fatal than the flu. In 2007, there were recommendations made that form a lot of what the CDC is putting out. In 2017, those were looked at again, very famous, and I encourage you all to look at the MMWR from April 21st of 2017. That's a lot of the post-action on H1N1 and what we've learned about flu. But of course, we're in a time where it isn't the flu. This is coronavirus, and every day we're learning something new. And I know that confuses people because, there's multiple conflicting ideas, and experts who do this modeling will differ in how they think it should be done. But by and large, there is a playbook, and we're all executing it, and it's going to unfold in, one state here, one state there. It's going to inch its way forward, but that's what you're seeing unfold.
That's the head of the State Health Department, Dr. Amy Acton, on the efforts to curb coronavirus. Thanks so much for joining us this morning on Columbus Concerns.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.